Hello doctors, have a beautiful day. Today we are looking at partial versus the complete mole. So firstly we are looking at the heading of karyotype. If you look at the partial mole has a 69XX or 69XYY. Next, if you look at the complete mole, it has 46XX or the 46XY. Looking at diagnosing, it is by missed abortion in case of the partial mole. In case of the complete mole, it is molar gestation. Next, we are looking at the uterus size. So in case of the uterus size, in partial mole, this is complete mole. So in case of partial mole, uterus size is small for the date, whereas in case of complete mole, it is large for the date. Next, looking at the theca luteal cyst. In case of theca luteal cyst, what we are seeing is that in case of partial mole, it is rare, whereas in case of the complete mole, it is about 25 to 30% of cases. Next, we are looking at the initial HCG levels. So in case of the initial HCG levels, in partial mole, it is less than 1 lakh MIU per ml, and in case of the complete mole, it is greater than 1 lakh MIU per ml. Now moving ahead, looking at the medical complications. Medical complication in case of partial mole is rare, whereas in case of complete mole, it is uncommon. Then looking at the rate of the subsequent GTN. So this is about say 1 to 5%. Here it is about 15 to 20%. Now moving ahead to the embryo fetus. So in case of the embryo fetus, in case of partial mole, and then we have the complete mole. So in case of the partial mole, the embryo fetus is present, whereas here it is absent. Then looking at the amnion. Amnion, fetal erythrocytes. So in case of the amnion fetal erythrocytes, it is often present. Here it is absent. Looking at villus edema, it is focal in case of partial mole, and it is widespread in case of complete mole. Then we are looking at the trophoblastic proliferation. So in case of the trophoblastic proliferation, in the partial mole, it is focal, and there is a slight to moderate, and in case of complete, it is slight to severe. Then going ahead with the trophoblast atypia. Trophoblast atypia is mild in case of partial mole, and in case of complete mole, it is marked. Then we have the P57KIP2 immunostaining. So here in partial mole, it is positive, whereas in the complete mole, it is negative.